Hello, I'm LaTanya Turner. As you've just seen, Nashville and Tennessee are starting to make some progress in improving children's health. But we still have a long way to go before we can claim that Nashville is the healthiest city for children to be born. To help us continue the conversation about what it will take to achieve that goal, we invited three guests into the studio. First, Dr. Michael Warren, Director of the Division of Family Health and Wellness for the Tennessee Department of Health. Also in the studio is Dr. Stephanie Bailey, who recently served 4 years as the Chief of Public Health Practice for the Centers for Disease Control and Prevention and was the Director of Health for Metro Nashville from 1995 through 2006. And Denise Couch, a community advocate and executive director of Organized Neighbors of Edge Hill, a neighborhood organization working with public and private housing residents, churches, schools, and businesses to improve life in the Edge Hill area of Nashville. Thank you all for joining us.
Thank you.
Let's start by talking about the term we've used so much in this report, culture of health, because I think some people might need a little clarification about what we mean by that term, culture of health. What are your thoughts?
I think when you talk about culture, certainly a person's values plays into part, social norms, what they're accustomed to seeing, with where they live, all of those things are a part of it. But the biggest part of something being a part of someone's culture is their sense of ownership of something. And so a person has to feel a sense of ownership around the value of health if they are going to create a culture of health.
Okay. What it actually does is health becomes the default factor as opposed to ill health or sickness or this is the way I've always been. It's just, it's the default. And people begin to grow up and think in terms of I am healthy as opposed to I am sick or I want to be healthy. It's I am. And the policies in the community are health promoting. And they create an atmosphere where everything you do touches on a health. There's health in all policies, there's health in all thinking, there's health in the way I act and conduct myself.
And I wonder, Dr. Warren, maybe we should also substitute words sometimes for health, such as, wellness or preventive health, because we're talking about before you really need intervention, yes, medical intervention, and sometimes people associate the word health with, getting medical treatment.
Absolutely, and I think when people think health, when many of us think health, we think health care. Yes. And we know that's only a small fraction of our overall health and well-being. And I think one of the things about culture is it just becomes part of who you are that you don't have to think about. So I don't wake up in the morning and think, well, I'm a Southerner or I'm a Tennessean, and because of that I'm going to do a certain thing. So if we think about having a culture of health, those healthy kinds of practices in the places we live, work, and play really just become part of who we are in that daily fabric.
Okay. I want to get back to ownership because that was a very interesting statement you made. How in your community do you get people to feel a sense of ownership about embracing this culture of health?
Everything is interconnected, and so none of the issues that we work on or that we look at operate in a vacuum. And so when you look at health, I also have to look at things like access to healthy food. The fact that Edge Hill is one of Nashville's 3 food deserts is a major factor.
And we might want to define food deserts for some of our viewers.
Absolutely. A food desert is an area where healthy food, a major grocery store, major grocery retailer is just not accessible. It's not in walking distance and it's not within a reasonable bus route. And so, so that's a factor. Transportation is also a major factor. And so as you're planning cities, as you're planning communities, including things like community centers where people can go and have active and healthy activities, having things like farmers markets where maybe once a week there's available produce for people, but also there's a big education piece. And so just offering squash and zucchini isn't enough if nobody knows how to really cook squash and zucchini, or if they just fry it to death, then you've just sort of defeated the purpose. And so when you look at ownership, you look at someone saying to themselves, this is important to me. And in communities that I've worked in, now and in the past, there's a trend of sort of short-sightedness that happens in poor communities. So it becomes less about what am I going to eat in a week versus what's going to be available to me now. It becomes less about, you know, what is my health going to be like in 10 years if I continue to eat like this versus I'm hungry right now and in 20 minutes after I eat this bag of chips I won't be. So that's a factor.
And is there an issue around, okay, this is important, you're telling me this is important for our culture, our community, but you aren't giving me some of the tools and resources I need. Is that kind of what it comes with this sense of ownership?
Well, it certainly does. But here, I want to bring in the concept of individuality and sort of personal values. It's been my observation over the years that people will get to and get what they value, what they prioritize, and what they want. And there's a lot of information out there, and I use the analysis of a horse. You can get a horse to water, but no matter, if I don't value that water, I am not going to drink it. If I don't value having squash, or if I don't value that, have not understood the value of that or become aware of that, I'm not going to eat it. And then it used to be that when people had a relative that would die of cancer or lung cancer, they would stop smoking. But something has happened where that's not even enough. So to get to ownership, my values, my experiences, my beliefs, my assumptions about things has to change first because those things go into thought, go into action, get results. And most programs and most actions that are developed are around the action stage so that in a political season or in a short time period, I can get results. But they're not sustained because you haven't gotten to the beliefs, the culture, the experience, my thoughts, my assumptions. And that's where we've got to be really more strategic in addressing.
But how do you do that? I mean, is it, you really can't legislate these values, as we know, but at the same time, something similar worked with smoking, child restraint seats. Until now, it's really taboo not to participate in a healthy way with those things. So do you sometimes have to sort of nudge people toward those values? What do you think, Dr. Warren?
So I think you can certainly put the supports in place that help an individual to make the healthy decision. And so you mentioned smoking, the Non-Smoker Protection Act, a great policy that's in place in Tennessee that really helps people to be able to breathe cleaner air at the foundation of it all. But it helps people to think, okay, I can't light up a cigarette in here because I'm in a restaurant or I'm in another public place. Doesn't say you absolutely can't. You could make the choice to do that, just like there are seatbelt laws. And you could decide, I'm going to get in my car today and not wear my seatbelt. Probably not the wisest thing for you to do, and certainly there's policies around it that help to shape that behavior. But at the end of the day, there's an element of individual choice in that as well.
Okay. Yes.
There is an element of individual choice, but I think that there are some things that we can do policy-wise. For instance, when we start looking at what is served in public schools, whether or not potato chips and sugary sodas are going to be choices in our schools. And a lot of it is personal choice. I look at, you know, my own family, and we don't have those things in my house, but I do know that at some point when they go out, they're going to make the choice to have it. But at least I can reduce the number of times that happens by not having it in my home. And so that's what I encourage people to think about. If you just limit the choices at your own home, then that can reduce what they're, and so the same thing with schools. If we look at doing sustainable things like planting school gardens, getting kids to participate in cultivating their own food, there's a great intrinsic reward that comes with that, and that's part of building that culture. If more parents would take their children to a farmer's market, talk to the farmers, pick out the produce, go home, cook a family meal together, and then eat it, that builds culture also. So it's not just this
involving everyone in the behavioral change. You know, I want to ask you, Dr. Bailey, because you have some perspective as former director of Metro Health. before the smoking policies were in place, and how did we get to a place where that was so accepted and embraced? And is there something we can learn from a development like that as we move forward with this culture of health?
You know, as you begin to do these things that begin to work and work well, and people begin to see the benefit and then begin to influence their circle of influence, you know, with modeling and with, you know, helping, like I would help him understand why the value of not changing them altogether, but just it takes a baby step at a time. I think you begin to get that sense of health and that culture of health and that embracing of that kind of choice,
We're talking about battling attitudes around convenience, mass marketing, access, just, you know, making all the kids happy. But so how do you deal with that?
The free market is beautiful. I mean, you keep the free market, and at some point, as the culture begins to change, the potato chips become less of an issue. You don't take, there is nothing worse than saying that I cannot eat potato chips. I'm going to find a way to eat potato chips. You know? I'm going to find that. There's always a black market for everything. So you keep the choices. And the good thing about the free market is that as I began to, you know, change my habits and begin to value being healthier and embracing longevity and my quality of life and just feeling vibrant, I'm going to choose less often that potato chip. But I'm not going to punish myself. And one of the things with dieting over the years is like you either got to let go all of this or, you know, or not. And in my practice as a physician, I used to work with patients around, okay, let's take what you do now. You eat what? 3 biscuits in the morning, let's try 2, because it never is to be a punishment. We don't do things in a revolutionary manner. Things are evolutionary, and you begin to show baby steps, and it begins to be more acceptable to people than resistant, because if you tell me I can't.
Well, and we kind of saw that, Dr. Warren, if you followed the story in New York City with Mayor Bloomberg's plan to ban large, supersized sugary soft drinks. And I think that's still on the table, but certainly it's not so much about people rejecting the concept as not wanting to be told what to do. So do you have any thoughts about whether or not we need to take sort of a, is there a nanny government that is needed in some of these areas just to get things moving?
Well, I think sometimes there are situations where there are public health crises or emergencies where certainly there have to be drastic changes put in place. But I think changing us as a society is very much like changing us as individuals. And as Dr. Bailey has said, you do that incrementally. And how do you build in supports and policies that help people to make the right decisions? Just like Dr. Bailey said, if I come in and say, don't do this, then probably not going to be the most effective way to change your behavior. But if I say, maybe this is what you should do, and here are some things that will support that, and I'm not saying ultimately here is the one decision that you have to make versus another, I think that can be a very successful approach.
Hitting it from all angles is important. So when you're making a change at home, and then a change is made in the school system, and then a change is made in your church, you're seeing it in several different places, and there's this reconciliation that this is a good thing, that, you know, I'm seeing it everywhere. And so that helps to sustain the change because you're being supported from a lot of different places. And I've seen a lot of churches in Nashville move toward using plates instead of styrofoam, and you know, stressing the importance of recycling. I've seen them move away from the fried chicken, and there's you know, grilled chicken or you know, whatever else, and there's fresh greens available, and there's not pork in every vegetable. And so it's a really positive change.
There is a question I have about whether we have sort of tackled all the, I use the term low-hanging fruit. I mean, we've dealt with child restraint. We've dealt with smoking bans in public places, seatbelt laws. Is there another area that we can tackle and find common ground as one of the experts in the piece said, so that everyone can say, okay, this is the next thing that we need to address that will make a difference. And do you have any thoughts about what that would be?
Healthy food options is a big deal, and I would say obesity, because obesity, especially childhood obesity, is linked. I'm on a panel with two doctors. Who am I telling? But it's linked to,
you see,
it's linked to so many other things. It's linked to diabetes and hypertension and all of these other, and it's also linked to self-esteem issues and a lot of mental issues. And I think that addressing that, trying to figure out, how to reduce obesity in children is a major step.
But that is going to be a more challenging than the things that we've tackled before, where it's kind of like, okay, you've got some, you've got a little bit of impetus.
Yeah, but over the last, I would say 10 to 15 years, you've been building the foundation towards that.
Okay.
And like I said, obesity takes in so many different risk factors and parameters. Just I guess 2 weeks ago, you're hearing about hypertension being more frequently diagnosed in children now, and none of us in public health are surprised at that. Having seen the trends, over a long period of time. But I think the system as a whole, if you look at the community and getting families back together where they're actually cooking food, begins to get at the nutrition piece, and people begin to see that food is pleasurable. One of the most critical ways was when Jamie Oliver went to Huntington, Virginia, and taught the school system how to cook. How wonderful. The kids were excited to see the vegetables and things. So I think that's one way, and then you talk about how do you, let's get out and walk, and people begin to park further away and not up close, and you see the trails and getting out and having fun, bicycling and walking. You don't have to join a gym. You can just go out and walk. So I think we're beginning to see those kind of changes.
It sounds like you kind of think we're farther along than we may realize in laying the groundwork.
I give communities a lot more credit than what is out there. What's out there, I do.
Absolutely.
Having to know communities.
Okay.
And I think, you used the word low-hanging fruit, and I think there's certainly been some of those victories, but I think if you think about the fact that we are a southern tobacco growing state and we have a non-smoker protection act.
Yes.
If you think about the fact that vending machine legislation is passed in schools, that's huge. And when you talk about those kinds of things, there are all sorts of barriers that pop up. Look at funding issues around the vending legislation, for instance. So I think that I would say we've really made some huge victories, and we're not in the 40s anymore if you look at overall health rankings.
Overall health rankings.
Now, none of us are happy with 39, but we're not in the 40s anymore, and I think those are huge steps. But I also think you're exactly right. We've got a long way to go, and before we can say Nashville or the state of Tennessee is the healthiest place for a baby to be born, we really have some work to do.
And I guess I wonder if the next steps are going to be harder. That's what I meant when I said low-hanging fruit. Have we done, are we at a place where, as you said, we've laid the groundwork, we've got some infrastructure in terms of attitudes and mindset, but now comes the hard part.
I think you're right, because it's hard to sustain I'm not going to say they're intangible, but it's hard to sustain a movement, towards something. And I think the key to that is young people who cause us to do the minivan, who cause us to, do things. I think that's changed. And then the baby boomers are usually a healthier lot of people, and they are living longer, and so they have a better appreciation of health. So I think it's going to be more difficult because of the sustainability and how people seem to lose interest and complacency. We always got to fight against that.
I'm very interested in the concepts with the Civic Design Center, but that's going to take everybody sort of pulling together and saying this is worth the investment, that we do something that deals with the infrastructure of how we develop our communities.
Absolutely.
Transportation and things like that.
Housing patterns, that's huge. And so now there's this big trend for everyone to move into the city, but a lot of times there are not affordable housing options in some of the most walkable communities. And so making sure that our city is deliberate about offering affordable housing, and not necessarily low-income housing, simply affordable housing for workforce people, to be able to buy, because who doesn't want to live in a community where they can walk, you know, they can work, live, and play. That's where everybody wants to be. And so making sure that you're deliberate about that, and also making sure that communities are mixed income enough to where you have models and support, and you have other people who go out and jog, and you have people that kids see that are walking to the store versus, you know, driving a car, and those sorts of things. Because when you mention tools and resources, one of the best tools and resources we could have are positive peer models and just role models and mentors in general. When you come in, and when I engage young people in the Edge Hill community, a lot of times they're very dismissive of things that they don't feel are a part of the fabric of their culture. So if I mention something like a yoga class or going hiking, they're very dismissive. I had one young man literally look at me and say, well, you know, black people don't jog. That's what white people with good credit do. And I thought to myself, you know, that speaks to a lot. I mean, it goes beyond just this thing around fitness. It also speaks to people feeling prohibited just because of their income levels, or just because of perceptions. And so how do you change that? I mean, you know, that hit me completely out of the blue, but unless we have people who come back to the community, who, you know, people that are involved and are willing to not talk down but talk to and pull up things, that's when things will change.
But and there are some strategies that we have to add to our arsenal. You know, that statement projects to me a need or something that's unfulfilled, a void somewhere there. And so incorporating things like life coaching or things that get at those sort of things, not just your traditional medicine, not just, you know, your holistic sort of piece, but that gets back to the individual and what his beliefs and things are, and awareness and exposure and his, you know, so getting back that, once you get him though, he will be a model and advocate for everyone else to change to as well. And that's the whole point, finding those persons who can be that spokesperson, because everybody can't speak to me.
Well, that's
everybody
what I say.
can't
It could
speak to
become
you.
preachy
So who do you
or condescending
who do
if
you
you're not
find
careful.
who can bring the message, you know, in a way that can cause a person to take a different step or make a different choice?
Yes, Dr. Warren, do you want to add?
I think that's spot on, and you've seen in some of these documentaries great success stories right here in Nashville, in communities where you may not think that we would have something positive changing from a health standpoint. And we've seen those stories, and so how do we get those individuals to tell those stories? Because I think we talked about ownership at the beginning of this, and if I think I have no control over something and I develop this fatalistic attitude, everyone in my family has diabetes or died of heart disease, I'm probably going to die of heart disease. Why should I care? But I can see people who have made a difference, and when I think I can control something and make a change, then I'm going to be more likely to do that. And I think when I see someone like me who has made a change in similar circumstances and with similar challenges, then I'm going to be much more likely to want to do that.
And are we talking about celebrities? Are we talking about?
Not necessarily. Not necessarily. Okay. It could be the house on the, going back to a commercial, it could be the house on the street where everybody gathers.
Okay.
You know, in a neighborhood, you know, engaging that person. It could be the barber shop. It could be the beauty salon. It could be that person that comes by every day that I see walking their dog, that has a routine. You know, people are watching. It does not have to be, you know, because you're talking about money and resources then. The communities have assets, and we need to know how to use those, and people are assets. And it's just, I always use this phrase, it's just like using your Matthew, Mark, Luke, or John. Who is that for me, you know, that can show me a different way and be my model. So it doesn't have to go big or go home.
Okay.
It can be right there. We just have to recognize the assets of our community and see what is, you know, the thing that makes the biggest difference in some people's lives.
We just have a couple of minutes, but as someone kind of at the street
let's go
level.
longer. No, more.
But I mean, you're out there dealing with people directly who sometimes have these perceptions or misconceptions about things. What are a couple of things that you're doing in the Edge Hill community to address some of those?
Well, it's just like Dr. Bailey just mentioned, we have a lot of wonderful assets in our community. Absolutely. And so some of the assets are our people, and they are people who some of the best motivators are not people that will tell you you're doing something wrong. They're people who will show you that there's a way to do it differently.
Yes.
And so making sure that you're not condescending, that you are building a rapport and a trust with people, and you're saying, I am not going to devalue how you live. I just want to show you that there's value in another way as well.
Well, for example, you have a community garden there.
We do.
And, I mean, talk about that for our viewers to understand. Here's a tangible way that this is applied.
Yes.
Just
So
briefly tell us.
I believe our community garden is Nashville's oldest, and so it's a very large garden, and we've got a lot of people from the community who have plots and they grow things yearly, and it's a big deal. And we also had what you call intergenerational gardening. So that's where we had some of our youth paired up with seniors from Gernert homes. And so there was a lot of great wisdom exchanged through those interactions as well. We do something called Pearls of Wisdom, same thing. You've got youth paired with seniors, and there's produce involved, but there's also a lot of talking and a lot of wisdom that's exchanged.
It's not always money.
It's not always money. And we can't let money dictate it. We cannot let money continue to dictate how our culture is driven. It's got to be the people. It's got to be the community resources.
Great. Well, speaking of people, I want to thank all of you for joining our conversation today. You can learn more about the children's health crisis in Tennessee by going to wnpt.org/children's health. Stay tuned to NPT for continued coverage of this issue. And we want to hear what you think. Write to us at tv8@wnpt.org or call our viewer comment line, 615-259-9326. Thank you for watching.
Major funding for NPT Reports Children's Health Crisis has been provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Monroe Carroll Jr. Children's Hospital at Vanderbilt, the Nashville Healthcare Council, Baptist Healing Trust, fostering access to compassionate healthcare in Middle Tennessee. Additional support provided by the Orrin H. Ingram Fund and by members of NPT. Thank you.